And so speaking of education, one of the foremost economists around the world in this area of medical technology and medical technology innovation is Professor Frank Lichtenberg, who is at Columbia Business School and has done decades of research. He has hundreds of publications that have been put out on the efficacy of innovation and the economics of innovation. Professor Lichtenberg, thanks for joining us today in this important topic.
My pleasure to be here with you, Stan.
And one of the things that you've been noted for through your career and your teaching, and again as a tenured professor at Columbia Business School, is around the impact of innovation, not just for the wealthiest countries, but for the entire globe, for the lowest resourced 100 countries. Talk a little bit about your research and how innovation and medical innovation has impacted everyone in the world.
Yes, well, thank you, Stan. Yeah, my research originally focused on the United States and other high-income countries, but increasingly I have been doing research more globally. For example, I recently wrote a paper in which I examine longevity growth in 39 countries, including both low and middle income countries and high income countries. And now I think medical innovation in general is important. For data reasons, I have focused on pharmaceutical innovation, which does account for a large part of total biomedical research spending. And what I found is, say, in the study of 39 countries, is that the countries where there is greater access to new drugs have seen greater improvements in longevity. And it's not only at the country level, but even if we look at specific diseases, that is how long people live and die from different diseases, we see that there's a very strong correlation between the availability of drugs in different countries, of new drugs in particular, and longevity. And I think economists in general realize that improvements in health and longevity growth is a very important part of economic growth broadly defined. Often when we talk about economic growth, we're talking about GDP, but economists like William Nordhaus and others have argued that in fact the growth in longevity in the worldwide over the 20th century was about as valuable as the growth in per capita GDP. Now, another study of a single country that I've done, I recently wrote a paper about Thailand. Thailand and other countries have what they call national lists of essential medicines, where essentially if a drug is listed on the NLEM, the National List of Essential Medicines, then the government is essentially going to provide that drug at no charge to the entire population. What I did in that study was I examined how changes in the National List of Essential Medicines have affected mortality rates in Thailand. And what I found was that the diseases where there were more drugs added to the National List of Essential Medicines have had larger reductions in mortality. And I estimated, for example, that the increase between about 2005 and 2015 in the number of drugs listed on the National List of Essential Medicines reduced the number of years of life lost before age 75, I believe it was, by about 650,000. So in other words, 650,000 people in Thailand got to live an extra year in 2015 alone because of the new drugs that were added to the National List of Essential Medicines between 2005 and 2015. And so I think that when governments can make these drugs, especially newer drugs, available to their populations, that will improve the health and longevity of their residents.
That's fantastic. Well, thank you very much, Professor Lichtenberg, for joining us today.
My pleasure.
just a tremendous impact his research has had over the last 30 years on understanding medical technology innovation in the global healthcare system. And so I think ultimately when we think about that, we know that he has and this idea that the diffusion of innovations, and ultimately if we look at the smallpox eradication movement from 1955 to 1979, we see that the diffusion of technology globally, it has to start, not always necessarily, but most of the time it starts with wealthier nations, so that the cost per unit of that technology can become available to the entire globe. Smallpox, which is the only disease to be eradicated from the planet, had an inoculation in 1804 in the UK, and eventually was wiped out across the planet in 1979. And then we look at the medications of HIV, AIDS, and how that's become largely available to many folks from low income and low resource nations. So we're seeing now digital health growing exponentially, and we're trying to understand how to make the digital health therapeutics, digital health apps, and especially artificial intelligence, machine learning algorithms more available to the globe at low or no cost to especially the lowest resourced 100 nations.